Hi there, this is Dr. Ma'in Hasib, the Accreditation Consultant and Quality and Safety Trainers in Clinical Laboratories, with another topic on safety, the complete guide spills in clinical laboratories. So on the subject of spills in clinical laboratories, we'll give you, in lesson 1, we'll give you introduction. We'll talk about spill types based on size, spills treatment method in kids, what to do when spill or accident happen. In lesson 2, we'll continue with the spills in clinical laboratories and how do you clean the spills and specific situation and how to deal with them when it comes to spills. So let's start with lesson 1. Hazard materials, whether chemical, biological, present a variety of hazards in the workplace. Accidents do happen, so you need to be prepared with the proper spill response procedure for the type of spill that you may have. What is a spill? A spill is to flow, run, or fall out, over, or off and become wasted or lost. Or a spill is uncontrolled release of a substance. It may be hazard to the people and the environment depending on what is the spilled material, the type of the material, how much is spilled, toxicity, reactivity, and temperature. It could be corrosive, such as acids, which can cause severe burn on the skin and eye contact. Resin fumes can be damaging to the respiratory system also. Each hazard material user must be ready and equipped to handle a spill. CAB standards and right to know laws require emergency and spill response training. Critical elements for a safe and effective response are information and knowledge of material used, the things you are dealing with, adequate spill response supplies, adequate training and knowing when and how to call for assistance. Also, when preparing your response plan, you need to consider the following: the location, existing ventilation, and natural potential spill. And to prepare, you need to collect SDS for the hazard material you are using. Keep them handy and available in a visible place. Understand the liabilities and the hazard of the materials before starting to use them. Maintain a call list, the daytime and after hours of individual who could or should be notified in case of an emergency or a code. Collect and maintain spill response supplies like spill kits. Know the location and how to use emergency equipment like the emergency shower and the eye wash. Train and practice for effective spill responses. So what are the spills types? Spill type can be classified into two major types based on size and danger: minor spill and major spill. Minor spill could be defined as an event that can be handled safely without the assistance of an emergency response personnel, or it could be categorized by all of the following. It's an inside the laboratory and has not spread outside the laboratory, does not result in fire or explosion, nor present a risk for a fire or explosion, and does not result in personnel requiring medical. Minor chemical spill is any hazard chemical spill that is not highly toxic, not highly reactive, or not explosive chemicals in a situation, okay, and not life threatening. This type of spill presents a manageable physical or hazard which can be absorbed, neutralized, or otherwise controlled at the time of the release by the laboratory personnel who, when wearing proper PPEs, will not be exposed to any chemicals at a level that exceed any recognized OSHA action level or permissible exposure limit, which is less than 1 liter. Minor chemical spill does not require a code orange or code brown activation. Major spills. Second type of spill is a major spill. It is defined as an event that cannot be handled safely without the assistance of an emergency response personnel, including all events where a person injured or contaminated. A major spill is characterized by all of the following criteria: result in a fire or explosion, or present a risk for a fire or explosion. Result in personnel require medical attention. It is not contained within a laboratory, or is categorized as a major spill by the institution or department policy. Major chemical spill: any hazard material spill that is highly toxic, highly reactive, explosive, or life-threatening chemicals. Any spill situation that presents significant fire, explosion, or other physical or health hazard risk, particularly if a person has been significantly exposed, contaminated, or injured. A medical or other outside assistance is also required. Any spill situation that may adversely impact the external environment, whether or not the spill occurred internal or external to a building. The quantities exceeding 1 liter, except for cytotoxic and radioactive isotopes, which are reported as major spills regardless of the amount. But in general, quantities exceeding 1 liter are considered a major chemical spill. This kind of spill, major chemical spill, require a code orange or brown activation. What are these spills treatment methods or kit? Spill kits are used to confine and limit the spill. Laboratories, administrations, or management are responsible and required to provide spill kits to deal with the potential risk associated with materials, whether biological, chemical, used in the laboratory. Spill kits must be appropriate to the section, placed, mounted in an accessible and visible location, not obstructed, and clear instructions are posted. Spill kits must be handled in accordance with manufacturer instructions. If no expiration date is assigned to a spill kit, it must indicate the date it was put into use, okay? And the director or designee must check it periodically and restore it after each use. The staff need to be trained on how to respond to a hazard spill and know the location of the spill kit in their lab. There are a number of different types of commercial spillage kit available. Okay, there is the reaction method, absorption method, infectious or biological material. And we'll talk about each one of them separately. The reaction method. It's commercially treating agent react with the spilled chemicals and neutralize it and minimize harmful and toxic vapor. Condenses the liquid and its vapor into the agent substrate. The most common specialized chemicals spill kit are acids, solvents, and gases. Neutralization, what does it mean? This technique is commonly used for the acid and bases. The goal is to produce a harmless chemical product. For acid, if you have an acid spill, use soda ash or sodium bicarbonate to neutralize it. For alkalis, use citric acid or boric acid to neutralize. The amount of a neutralization agent can be difficult to determine, although pH paper or the absence of VISI can determine the endpoint of the reaction. The neutralization reaction generates heat. So if this heat is generated too rapidly, a splattering can occur. Neutralizing agent should be added cautiously and slowly. Neutralization for very large spill is not practical. In this case, or in these cases, absorbent should be used to remove the bulk of the spilled material before neutralizing any residual material in the spill area. The wet slurry which remain may need to be collected by absorption, or if the product is harmless, may be washed away. Allow approximately 30 minutes for any airborne mist to settle or to be dispersed. However, it may be necessary to provide additional ventilation to reduce the vapor concentration of the split liquid and the risk of fire or explosion. Next, the absorption method. Assimilation of one material into another. Liquid is taken up into the physical structure of fibers of the sorbent. Soak up the liquid and contain the spill, disposed of correctly. Proper absorbent material may include absorbent billows, pads, mats, sand, soda ashes, kitty litters, and cotton wool swabs for the biological waste. The absorbent material may include, they come in different shapes or long square which can be placed in or over the spill, or sausage shape to surround the spill and contain it. Solidifying agent that once you dike the spill with and apply it will absorb the liquid, contain the spreading, and prevent aerosol generating, forming a semi-powdered mixture. Next, infectious biological material. Solidifying agent, paper towel, pads, decontaminate the area with an approved disinfectant and dispose as biohazard waste. In all hazard material spill situations, the primary concern is the protection of personnel. The secondary concern is to confine the contamination, minimizing or preventing the evaporation and orization of the material, but only if you are trained to do so. The release of or spill of hazard material will require a different response based on a variety of factors, including the location, amount, type, and location of the spill. The laboratory should have its own specific cleanup procedure and all personnel handling such material should receive training on that procedure. What to do when a spill accident happen? Okay. This is general guidelines regardless of the type of spill. Okay. General guidelines. In the next lecture, we'll talk about special situations and what you need to do with them and how to handle them. So these are general guidelines to deal with the spill regardless of the spill. Immediately protect yourself and others with appropriate PPEs. Alert the others in the area of the spill. Minimize or contain the spreading of the spill and to prevent the evaporation and analyzation of the material. Isolate the spilled area. Limit access in case flammable spills. Remove all sources of ignition. Ventilate the area. Control the source. Okay, turn off the valve as applicable. Turn the bottle or flask upright. Identify the spilled material. Evaluate the hazard and take safety precaution to avoid exposure. Treat the spill properly by selecting the appropriate treating agent or method and dike the spill, cover with agent, avoid splashing. Mix gently the treating agent into the spill by a scoop or a scraper. Clean up spillage promptly. Ensure neutralization of the reaction. No bubbles, heat, uniform mixture based like residue pH indicator. Dispose of any hazard material as toxic waste. Report the incident per your departmental policy. A step taken to prevent the reoccurrence of such an accident or incident. Reassess if retraining for staff is needed. Some note regarding that. Treat the spill if safe to do so. If not, initiate code orange or brown, or you use the code in your facility for such thing. Messy workers are usually poor workers and they are the one who cause accidents. I am done with lesson 1 on spills in the clinical laboratories. To continue with the subject, please go to lesson 2, which is the last lesson on this topic, where we will be continue with the spills in the clinical laboratories, and we will be talking about how do you clean spills, specific situation, and how to deal with them. The specific situation when it comes to spills, okay, and how to deal with them. Thank you very much for watching.